According to Donate Life America, 100,000 men, women, and children are currently on a waiting list to receive a life-saving organ transplant. And each year, 7,000 of them die because they didn't get help in time. What are the numbers like here in Oklahoma? That's the topic of this week's in-depth conversation with moderator Susan Cadeau and her guests.
Thank you, Rich. Organ donation, such an important issue, not only for the state of Oklahoma and the nation, but the world. And we're going to talk to two folks who know everything we need to know about this. And I'd like to welcome them now and introduce you to them. First, we have Jeffrey Orlowski, who is president and CEO of LifeShare Oklahoma, organ finding and managing organization. And they also conduct some research. And then we have Dr. Vivek Kohli, who is an abdominal transplant surgeon at the Integris Nazi-Zuti Transplant Institute. Thank you both for being with us.
Thanks for having me.
First of all, I'd like to start with you, Doctor. You work, of course, at Nazi-Zuti Transplant Institute. Dr. Zuti was very significant, played a very significant role in the transplant field here in Oklahoma. Is that correct?
That's right. He was the key individual who started transplants in Oklahoma. He established the transplant center here at Integris Baptist Medical Center, and he started with heart transplants. He's primarily a heart transplant surgeon, and he started with heart transplants way back in 1985. That's when the first heart transplant was done in Oklahoma. There's a very rich history that is very nicely displayed at the Oklahoma History Center on Dr. Zuti and his achievements, not only in the heart transplant part, but other things that he contributed to. So you're right. So that's where it all started with him. Then lung transplants were brought in a few years later. Following that, in 1993 or so, liver transplants.
Jeff, what can you talk about? What can you add to the conversation about the history of organ transplants in Oklahoma? Are we pretty on the cutting edge? Have we been on the cutting edge in years past, and are we now?
Yeah, we're really blessed in Oklahoma by the transplant community that we have and the support that we have in the community for organ donation. When you look back at the evolution of transplantation since the mid-1980s as modern immunosuppressive medications became available and made transplantation more therapeutic, Oklahoma has been on the front edge of donation and transplantation throughout the course of that time. And today we are one of the leaders in the world in organ recovery. We're on the cutting edge of a number of new technologies in organ preservation that will allow organs to be preserved longer and better. And our transplant programs are doing tremendous work, and in many cases more transplants than they've ever done. So it's a very exciting time, and it's a very exciting place to be a part of.
Dr. Jeff just mentioned some of the advances, anticipated advances as well. What is most exciting for you in your field today?
Well, looking at abdominal transplants, when you look at liver, kidney, and pancreas transplants, the thing that's been brought about for kidney transplants has been pumping the organs on machines outside, and that has enabled transplants to be done, organs to be transported for distant places, and transplants to be done in a more scheduled fashion for the kidney transplants. For the liver transplants, what is important, what we're looking at in the next some years is similar advancement on machine pumping organs and utilizing organs that might be considered right now considered marginal, but making those organs better functional in patients. So improving the utilization of the donor pool is what we're looking at, and that's what we've been working at in the last several years here in Zuti Transplant Center. Yeah.
I do want to talk about the donor pool, but I want to get the information so people understand what's needed. When they understand what's needed, why it's needed. There's a very short window of viability for an organ. Is that correct?
That is correct, yes.
And does it vary depending on the organ, and what's the range?
Absolutely. So literally for heart transplants, you want them in in a matter of some hours. But so the organ's removed from the donor and it's transported right to the transplant center. And majority of the times, the transplant center is already prepared with the donor, with the person who's going to receive the heart to be put in. So literally no time gets wasted there as far as the heart transplant's done. With other organs, there is a better range of time for preserving them. For example, for livers, most of the livers that get transplanted at our center are transplanted within a matter of 5 hours. But you can extend that time all the way up to 10 to 12 hours if necessary. But we don't tend to do that. We try and do that as quickly and as soon as possible.
So Susan, right now from LifeShare perspective, when we're coordinating donors with transplant centers, what we see from centers around the country is that they want to have the heart transplanted in roughly 4 hours from the time that it's recovered from the donor until it's beating in the chest of the recipient, and allowing for transportation time and time to actually anastomose, sew the organ into the recipient. It's very, very tight time window and limits how far the organ can travel.
So earlier we were talking, and I'm going to start this question off with you, but I want to talk to the doctor about it as well, as the need in Oklahoma. Before we began, the doctor was saying he's kept quite busy. So Jeff, how bad is the need versus the supply in Oklahoma?
So on any given day in Oklahoma, the waiting list is between 620 and 650 patients waiting for organ transplants of all types. The predominance of those are going to be patients waiting for kidneys, followed by livers, hearts, and lungs. We annually recover in the state of Oklahoma and provide for transplant. Last year it was 584 organs, but not all those organs stay in Oklahoma. Not all the organs transplanted in Oklahoma originated from a donor in Oklahoma. We share more broadly than that. And so I think putting it in perspective, in Oklahoma, the list is around 625, let's say, and it varies from day to day. So around 625. And when we look at the national waiting list, it's 106,000. And what that means on a national level is that every day 20 people die waiting for a transplant that doesn't come. And every 10 minutes, somebody's name is added to the waiting list nationally. In Oklahoma, we're fortunate because we have a successful donation program and we have successful transplant programs. And so our waiting list has actually decreased over the course of the last decade, while the national list has been pretty static at the level that it's at.
So Doctor, I want to stay with you for a minute. For the past 2 years, we've been dealing with this pandemic with COVID and different variants. Has that affected the program and the work that you do with patients? Has it caused things to slow down? Are people immunocompromised because of this?
So it has obviously affected the transplant centers in a variety of ways all through the nation. And even at our transplant center, the various programs have been affected differently. Say, for example, on the heart and the lung side, we slowed down a bit because of the pandemic. Lung transplants definitely slowed down all over the nation because of the COVID being primarily a respiratory viral infection. Fortunately, on the liver transplant side, we were able to keep up with our efforts, and we actually ended up surprisingly doing more transplants through the COVID pandemic. And it's got not to do with just because of the pandemic, because there were some organ allocation system that was changed for liver in that year in 2020. So that brought more organs to patients in Oklahoma in that sense.
Interestingly, though, in 2021, we had record levels of donors, organs provided for transplant. And similarly, on a national level, the United States transplant system achieved an all-time record for donors and for organs transplanted as well. So I think despite the challenges the pandemic has presented for us, we've been able, through the partnership with our 145 donor hospitals in Oklahoma and with the transplant centers around the country, and certainly with transplant centers in Oklahoma, who've been incredible to work with through this. We've been able to not only weather the impact of COVID, but continue to grow the benefit of donation in our community.
Where do we stack up as far as the percentage of citizenry who are organ donors in Oklahoma?
So in Oklahoma, our state registry now, almost 66% of the adult population is registered to be an organ, eye, and tissue donor. And that compares very favorably to a national number that's around 54% for other state, on average for other states. In terms of donation per capita, we pretty regularly are ranked in the top 5 donor states in the country and produce, have an incredibly generous number of donations from our community here in Oklahoma. So we're very blessed in that. We work very hard to be good stewards of those gifts and to maximize how they're utilized. But Oklahoma stacks up, not surprisingly, very well. I think the spirit of community here and the spirit of Oklahoma Strong that we're all familiar with comes through loud and clear when people have the opportunity to donate an organ and save somebody else's life.
It's true. Yeah. So I'm going to go ahead and ask something. When we talk about the number of transplants, what about the survival rate of transplants? The number of transplants are up. Is the survival rate still okay, or has that dipped?
Yes, the survival rate has been good for the transplant, and at our center we've done well with the outcomes for the liver transplants and the kidney transplants that we've done over the last year in the pandemic. The number of heart and lung transplants slowed down, as I mentioned before, and those patients what have been transplanted have done well. So we've been very selective. One of the problems that came up, particularly for us in Oklahoma, was that a large section of our population was not vaccinated. And it did take a huge effort from the transplant centers, all the team members in the various transplant units, to ensure that we worked very hard to get our patients who are waiting for organ transplants to get vaccinated. And that has been a problem throughout the nation as well, in various parts and communities of the country, where people who've been on transplant wait lists as well had reservations about going through the vaccination process. And it did bring up several ethical questions, considerations, but we've kept up with taking care of patients in all ways and forms, even if they had choices of personal choices of for whatever medical or other reasons not to keep up with vaccinations.
Maybe the last thing I'll get from each of you is, what is the most common misconception you hear from people who might be a little afraid to become organ donors, and what would you say to them? Just quickly address that for us.
So that's kind of in our daily activity is talking to the public about donation. And probably the biggest misconception we hear about donation is that people are, because of their age, their health, their condition, not a suitable donor. And the reality of it is almost everybody can donate something. It may be corneas, it may be tissues, it may be their liver, it may be their kidneys, it may be many things that they can donate, but most people can donate something. And so what we encourage people to do is don't screen yourself out for donation because you feel like you're too old, you're too sick, or whatever. Register to be a donor, tell your family to be a donor, that you're a donor, and let us figure that out at the time. The oldest organ donor I've ever personally been involved with was 93 years old.
Wow.
And they donated their liver. I've been involved with an 82-year-old who donated lungs and kidneys that were transplanted.
And Dr. Coley, I'll give you the last word. Anything you want to say to folks as they're considering organ donation?
What I'd like to say is that Oklahoma and people in Oklahoma are one of the most generous people that I've known. I've been in various parts of this country. I've lived in different parts, and I've seen that this is a really very generous community, and it's a very giving community. And I really appreciate what they do. And I feel people in Oklahoma are one of the most giving people, and I can only appreciate that and say thank you for doing what they do for everybody else in this community and for sharing their lives and their loved ones with anybody else as and when they can. Yeah.
And I would like to say thank you to both of you, not only for your time today, but for your work in actually saving lives in Oklahoma and around the nation. Thank you both very much.